Hello, Sherry. I'm here to develop an oral hygiene routine with you. Is that okay?
Yeah, that sounds fun.
Okay. Sherry, it looks like you have some periodontal disease present and more prevalent in your front teeth over here. You can see from the photo.
So what is periodontal disease?
Periodontal disease is also called gum disease, and infection that damages soft tissues attachments and without treatment can destroy the bone that supports your teeth. So it could also cause your teeth to loosen and lead to tooth loss. Okay, there is strong evidence that the connection between periodontal disease and coronary heart disease and stroke. There are also some negative effects for pregnant women. You are at an increased risk of preeclampsia and a higher risk for preterm babies.
How did this happen?
Well, Sherry, it starts with your gums. When you aren't brushing and flossing correctly, over time, bacteria will build up in the sulcus of your teeth, which is the little pockets in between your teeth and your gums, and can create an ulcer where the bacteria from your mouth can enter your bloodstream and enter your heart. Okay, so individuals with severe periodontal disease are at a 3 to 3.5% higher risk for a heart attack or stroke.
Okay.
Sherry, I would like to recommend you a disclosing agent like Sunstar Gum Red Coat. This is great for you, Sherry, because the tablets come in bright red or blue and it's easier for you to see. The tablets show you where there is buildup from the plaque in your teeth so you can focus your brushing and flossing there.
Okay.
Okay. I also recommend you trying the Bass circular brushing technique. With this, you'll be able to access under the sulcus to help reduce gum inflammation. Okay, so I will show you how to do that right here.
Okay.
Okay, so you are going to go in with a 45-degree angle. You're going to add some pressure at the gum line.
Okay.
And you're going to do vibratory motions 10 times and then overlap and move to the next section.
Okay.
Okay?
Okay.
So I have a toothbrush for you and you can try it.
Okay.
Yeah,
Okay.
so go in 45-degree angle. Okay, and then, yeah. And then move to the next section, overlapping. Yep. Okay, good. Perfect. Okay, so you've mentioned that you have some concerns about stains on your teeth. These stains are likely caused from smoking or any, like if your cola beverages that you drink. I would recommend first trying to quit smoking, okay, because that would be good for your overall health. There's also Colgate Total Advanced Whitening toothpaste that you can use. It'll provide some teeth whitening and also fights plaque and tartar. And I know you've mentioned that you don't use a mouth rinse. I recommend adding that into your oral hygiene routine. Use an antiseptic rinse with a zinc chloride, like Listerine Ultra Clean Gum Protection. Use that twice a day for 30 seconds. This will help fight plaque and tartar buildup.
Okay. I mean, that's a lot of steps to do. I don't even know if I have time to even floss in the morning.
Okay, so quality of your brushing and flossing is better than quantity. So if you only have time to floss and brush at night, even now, and then that'll be fine, but try to at least use the mouth rinse in between when you don't have time to floss. Okay? Or even I suggest a tongue scraper. Okay? So we do offer a fluoride treatment in the office, and this would be beneficial to you because you're at a high risk for dental caries, which are decay, like cavities.
Okay.
We can apply fluoride to the teeth so that we can slow down the advancement of dental caries by 40 to 50%.
Wow.
Okay, and placing a Pitt and Fisher sealant right behind your front teeth would help prevent bacteria from getting into those hard to reach grooves and in turn prevent any more decay.
Okay.
Okay, does that sound good?
Yes.
Great.
Hi Sherry, my name is Erin. I'm a dental assistant here at the clinic. So today I'm here to talk to you about some nutritional counseling. So the reason we're doing this is to help with your overall health and your baby's future oral health and overall health. Being pregnant does take a toll on your teeth, and the baby does rely on you to be at your best, but I know that's easier said than done, especially when you have a little one already running around at home. So for your health and baby's health, I'd like to make some suggestions to you, and some suggestions and changes to your diet. We're going to break it down into some steps to make it easier and a little less overwhelming. Let's start with something easy first, with what you are drinking in a day. The farther along in your pregnancy you go, it's important to stay hydrated. Pop, energy drinks, alcohol do not keep you hydrated. Beer is actually very dehydrating, so we need to work towards reducing the amount of pop and energy drinks that you're consuming in a day. You can download free apps on your phone that help remind you to drink more water. The more water you drink in a day will be better for your teeth, because drinking more water makes your mouth produce more saliva, and this is very beneficial to your teeth. I'd like you to try, with the help of reminders, to start drinking at least 2 500 ml bottles of water a day. You can still have pop, but look at it more as a treat rather than a go-to beverage. I'd like you to try and cut out the energy drinks as much as possible. The caffeine is not good for you or the baby. Try substituting with fruit juice and flavored water instead. Hopefully with the help of the app and the reminders, you'll be drinking more water than any other beverage throughout the day. Now let's talk about your diet. You said you have gestational diabetes. This is a condition that, if not handled properly, can develop into something more long-term. So it's best to manage this condition by adjusting your diet. This might be more difficult, as it's not just, eat more fruits and vegetables. I would suggest getting an agenda and trying to plan out meals where you can, so as to reduce the amount of fast food that you're eating in a day. I would suggest buying fresh fruits and vegetables and meats. With buying fresh and planning ahead, you save money and have meals over multiple days instead of fast food that's just good for that day. As for your snacks, instead of crackers and chips and cheese, you could try more like fruits and nuts, like cashews and cranberries. Cranberries are very low in sugar, and nuts have lots of protein, and some nuts contain lots of iron, so that'll give you more energy and more satisfaction to get you to the next meal. For lunch, you could try dark green leafy salads with kale, with like plain grilled chicken in it mixed in. Dark greens are full of vitamins like vitamin K and A and iron, which will give you more energy. They're good for your skin, and that'll make you more energetic and get you through to that next meal and get you through the day without having to reach for an energy drink. So hopefully that'll help you reduce the amount of energy drinks you're drinking in a day until you're not reaching for them at all. For breakfast, you could try making breakfast sandwiches at home in advance and wrapping them up, putting them in the fridge, and then you can just grab one and go first thing in the morning, instead of having to stop and grab fast food. So try these steps first, and when you come back for your next appointment, we can see how you're doing, and we can go from there.